stuff. They're like, sometimes some hospitals will help you out, pay things, or give you a cheaper rate.
They're a long process with a lot of bureaucratic hiccups.
Fine.
But it'll still bankrupt you. Don't get me wrong.
Recently I was approved for Medicaid, which I thought was going to be the best thing ever. That opens the door to a primary care and opens the door to specialists. The specialists are not even in the area. You give me an hour drive to get to a doctor, that's absolutely inaccessible. And at this point, you're kind of like, well, I wish I just had no insurance, because that little aspect of hope is sometimes worse than accepting the fact that you have no hope. We're looking into filing bankruptcy, because a lot of the medical bills, even though I was low income, for some reason they still went to collection, even though I contacted people. Even some of the medical bills from when I had good insurance, where I was supposed to have no copay, are now in collections because I didn't know about them and I was moving.
Now, this is off topic when it comes to healthcare and what we should be talking about. But we go back to world domination, right? And these rich people thinking, you're a piece of shit, we can just push a button, you give us our money. That attitude, what do you think is going to happen? They have plans, they have ways. They believe you are actually something else than them, right? They will come up with all sorts of excuses that you're lazy, but yet they just push a button. You know what I mean? And so you'll find that, if I'm right, or if people are right, you'd find that it's not a conspiracy, that you'll see a pattern in all sectors, right? When it comes to the rich people's power and abilities to try to make business. It's about business, right? And they want to make all the money and control your ass, just like a business getting all the customers. That's what they're doing. They want all the customers, and they want to make sure the customers are hooked or forced to be through them, right? And so what they do is they're trying to suck everything dry to get control over you, best domination, and to let you not see is to trick you and fool you to make you go into debt and then go, do you need my help? You see? That's what they're doing. All around the world, they do it in their own little tricky ways, right? So they don't get help until they're bankrupt. So once they've already hit you there, that's their plan. They're going, all right, they're there. We can't arc them up anymore. We've got to show them there's something. Now we give them help because we've taken everything they've got, right? Now we can give them a little bit of help back because we're doing it to everyone else. We've got more than we need. As we see, that there's 10% of the world's population, less than 10%. It's got all 90% of the money. That's how they get that. Just think about it. I know there's a lot of people out there that don't think too much as you're too busy in this stuck system that they're doing to you. And so when it comes to medical, they've taken over that system and you, because you allow them to create laws and allow businesses to create whatever money prices they want to do, like they were talking about doctor billing and all these things. And they allow it, the government, so you can attack each other. So they go, I didn't do anything. It's all about, wasn't me, where's the proof? You know, if you can do that in this world, you pretty much get away with everything. They did it to themselves. I know we didn't really offer really much help, but they took it. You know what I mean? And that's where we are today. We look back and we go, why are we in debt, this? Because we thought their help, which was great, false gifts, weren't. They're just putting us into debt, making you more controlled, where they'll come to you if you whinge too much. You got debt, you got this, you're nothing now. You're nothing. As we made medication controlled and we took all your money through it and through rent and high inflation and food. We got rid of these farms so we make food. It's really simple. If I had money and I had a plan, you can easily do that. And people will do what they do today. Just propaganda, just speak. And if you know that, then it's going to happen. And what's happened in history and it's happening. So when it comes to Medicare, you know how you can fix it. I'll give you a quick rundown. As I just did a comment about, Medicare doesn't need to be funded. It needs to be able to fund itself so it can fund you, right? Otherwise, your people yourself are just going in debt, which is a lot of Medicares are around the world. So is ours. It's hanging on. We're gonna keep feeding it because it doesn't work. And all that money goes to the private sectors that control your ass, and you allow it, and your government allows it. When it can easily take over that section. The governments, to have a good healthcare system, need to own the healthcare system, right? Not private companies, right? And get a hold, and we can duplicate just about 90% of all medication out there. China does it. Right? They call them, cheap version of medication, right? You can make it yourself. And what the country needs to do, instead of paying for these rich dudes, because what countries are doing, they're going, well, how much do you want for the medication? Shitload of money. Shit. Oh, okay. They get it cheap because we're going to pay behind the scenes. You got to get rid of that. Huh? And they go, you need to pay. And so they go dearer and dearer and dearer. People are paying $10,000 for little pills that cost $1 a month. Because they can. And you allow it. And your government allows it. And you're not stepping up and going, we need to take over this area. And how do you do that? You take over the medication area and the profits of those areas. You're going to need medication. Everyone needs headache pills. The government, it's total profit for the government, not the big rich dudes. They should be out of our healthcare systems, why we don't have one. All right? Back to the king. The kings used to be cunts back in the day, but these days we can do it right. Right? And in the healthcare system where it buys its pills, it makes its price. So it gets the pills or makes the pills. So it can make it or get it itself. So if you're buying $10,000 pill, it can be made for $1, make it yourself. Right? Go tell them to go sit on that rotate. Right? And you make it yourself. And the profit that you get, because they make a shitload of profit. You want to see the biggest profit around the world? Where it's lying at? In the medical section, you see? Because you allow them to steal your profit. Just like in the electricity section. You all need electricity, but you hand it over to private people that charge a lot of money and go bankrupt and fuck up just like you do, because they're doing the same decisions, but they want to. You know what I mean? As they go on holidays and buy things and use company money to go bankrupt or not really look at it. They just want to make some money and walk away. Go for a beach walk, right? And this sector controls the profit and the money. And then who else needs it? So the poor sector, right, with all that extra money and profit is sort of to the rich people, goes to the poor for the country. Their own profit of their own country. Right? So the rich people can afford and all that profit, no extra profit gets made for a benefit. And when it doesn't get made for a benefit for someone doesn't want to come in with business and bullshit it around. It won't be able to be bullshitted. It's not business. That's how you fix Medicare. If you don't do that, you're not going to fix Medicare. And there's a few other little steps to what you need to do, but that's pretty much the quick rundown of how a Medicare system can support itself and then support the lower ones for you, right? And the government doesn't need to support it. And if they ever did get low enough, right, where you just couldn't make medications properly or cheap and weren't making money, countries cut you off and you're buying your own and all this kind of stuff, well, that's what's going to happen. They're going to try that. But you've got to show that working for the people works best than controlling them. That's all you got to do in the end. And trust me, the medical system I was just talking about, Medicare, and the way of taking over those sectors, will make a shit load of money. In fact, it'll make more money. That's more likely, if I'm right, how much money goes in these areas. If they want to charge it just as much, they would have too much money. So they bring down the cost for how much money you have. And if you charge too much to the people, well, at least you'll have all this shitload of money to build hospitals, to build more medication, to put into medication and stuff like that. It's not just a waste of money going to the rich dudes. So have a good one and see you later.